Gentlemen, let me ask you something that's going to sound strange at first. How many years have you been searching for the G-spot in completely the wrong place? Most men spend their entire intimate lives believing they know where it is, confidently touching an area that's nowhere near the actual location. And worse, they have no idea they're looking in the wrong spot because nobody ever taught them the truth. Hello, I'm Dr. Mika Hayashi, a urologist with over a decade of experience helping men over 60 improve their intimate relationships. Here's what the research shows. The G-spot was first scientifically identified by German gynecologist Dr. Ernst Grafenberg in 1950. But what became popularized in books and media in the 1980s contains critical location errors that have confused men for decades. Studies using ultrasound and anatomical dissection confirm that the G-spot is located 5 to 8 centimeters, about 2 to 3 inches, up the anterior vaginal wall. But its exact position, size, and sensitivity vary dramatically between women. Today, I'm revealing the real anatomical location of the G-spot, why 99.9% of men can't find it, the 3 biggest mistakes that guarantee you'll miss it completely, and the exact technique that works for women over 60 whose anatomy has changed. This isn't guesswork. This is medical anatomy backed by decades of research. Before we dive in, hit that like button right now, comment below where you're watching from, and subscribe so you never miss strategies for men over 60 who want to satisfy their partners completely. Now, let me reveal why almost every man is looking in the wrong place. Before I give you the exact location and technique, you need to understand why this spot has been so misunderstood for decades. Here's the common belief. The G-spot is just a few inches inside the vagina on the front wall, easy to find with your finger curved upward. But the reality is far more complex. Research shows that individual anatomical differences mean the G-spot varies in location, size, and even existence between women. Studies confirm that the G-spot is an area of erectile tissue located on the anterior vaginal wall, between the vaginal opening and the urethra, typically 5 to 8 centimeters, 2 to 3 inches, inside. But here's what nobody tells you. In some women, this area is thick and pronounced, measuring over 6 millimeters in ultrasound studies. In other women, it's barely detectable, measuring under 3 millimeters. Research published in the Journal of Sexual Medicine found that women who report strong vaginal orgasms have significantly thicker urethrovaginal tissue, the area where the G-spot is located, compared to women who don't experience vaginal orgasms. This means anatomical variation determines whether a woman even has a highly sensitive G-spot. But even when the G-spot exists and is sensitive, most men still can't find it because of 3 critical mistakes. They're searching at the wrong depth, using the wrong pressure, and stimulating at the wrong angle. Let me explain each mistake and how to fix it. If this makes sense, hit that like button and drop a comment. Mistake number 1. Searching too shallow. This is the most common mistake that causes men to miss the G-spot completely. Here's what most men do wrong. They insert their finger about 1 inch inside, curve upward, and press against the vaginal wall, expecting to feel something. But research confirms the G-spot is located 5 to 8 centimeters inside, which is 2 to 3 inches, not 1 inch. This depth error comes from popularized description in the 1980s that oversimplified the location. Books told men, just insert your finger and curl upward, without specifying that you need to go significantly deeper than most men expect. Studies show that the G-spot is positioned near the base of the clitoris internally, where the clitoral structure wraps around the urethra. This anatomical positioning means it's located deeper than the vaginal entrance, typically 1/3 to 1/2 the distance toward the cervix. For most women, this translates to 2 to 3 inches inside when measuring from the vaginal opening. But here's the critical detail. During arousal, the vaginal canal lengthens and the G-spot becomes more accessible. Before arousal, it may be harder to reach and less sensitive. The fix is proper depth and timing. Wait until your partner is fully aroused. Arousal causes the vaginal canal to expand, blood flow to increase to the G-spot area, and sensitivity to heighten dramatically. Insert your middle finger or index and middle fingers together 2 to 3 inches deep, significantly deeper than most men go. You're aiming for the area between the vaginal entrance and where you'd feel the cervix at the very back. The G-spot is closer to the entrance than the cervix, but much deeper than the first inch. Use a come here motion with your finger curled upward, but only after you've reached the proper 2 to 3 inch depth. Within minutes of stimulating at the correct depth with proper arousal, most women with sensitive G-spots will experience intensified pleasure, potential swelling of the area as blood flow increases, and distinctly different sensations compared to shallow stimulation. One patient's husband, 69 years old, had been trying to find his wife's G-spot for over 40 years without success. After I explained the depth error, he realized he'd been stimulating it barely 1 inch deep his entire marriage. Once he went to the proper 2 to 3 inch depth during high arousal, his wife experienced her first vaginal orgasm at age 67, he said. I'd been looking in the completely wrong place for 4 decades. Proper depth is the foundation of G-spot stimulation. Comment below. Did you know the G-spot was located 2 to 3 inches deep, not just 1 inch? Mistake number 2. Using the wrong pressure, too gentle or too aggressive. This mistake prevents pleasure even when you've found the correct location. Here's what men get wrong. They either touch the G-spot too lightly, creating tickling sensations instead of pleasure, or they press too aggressively, causing discomfort or even pain. Research shows the G-spot requires firm but comfortable pressure, distinctly different from clitoral stimulation, which is often more gentle. Studies confirm that the G-spot consists of erectile tissue similar to the male corpora cavernosa, which means it responds to pressure rather than light touch. Dr. Ernst Grafenberg noted in his original 1950 research that this zone is more readily stimulated by firm digital pressure than other vaginal regions. But here's the nuance most men miss. The correct pressure varies based on arousal level and individual sensitivity. Before arousal, the G-spot may be uncomfortable to touch firmly. During high arousal, it can tolerate and respond positively to significantly more pressure. Think of it like massaging a muscle. Light, tickling touches don't penetrate deep enough to affect the tissue. Aggressive jabbing causes pain. The sweet spot is firm, rhythmic pressure that compresses the erectile tissue without causing discomfort. The fix is graduated pressure with communication. Start with moderate pressure once you've located the area at 2 to 3 inches deep on the anterior wall. Use a rhythmic come here motion with your curved finger, applying firm but comfortable pressure. Pay attention to her response. If she tenses, pulls away, or shows discomfort, reduce pressure immediately. If she relaxes, breathes deeper, or pushes toward your hand, gradually increase pressure. Ask directly, is this pressure good, or would you like more or less? Communication removes guesswork and builds trust. The ideal pressure creates a deep, internal sensation that women often describe as filling or pushing, rather than the sharp, surface-level sensation of clitoral touch. Within 2 to 3 minutes of proper pressure at the correct location, most women with sensitive G-spots will experience the area swelling and becoming more pronounced, increased natural lubrication, and intensifying pleasure that builds toward orgasm. One patient's husband, 72 years old, had been touching his wife's G-spot too lightly for years, thinking gentle was better. After I explained that erectile tissue requires firm pressure, he adjusted his technique. His wife reported the difference was night and day, finally experiencing the deep internal pleasure she'd heard about. He said, I was being too cautious. Once I used proper pressure, everything changed. Proper pressure is essential for effective G-spot stimulation. Mistake number 3. Ignoring the angle. The 45-degree rule. This is the advanced mistake that even men who find the location and use correct pressure still make. Here's what's wrong. Most men insert their fingers straight back and simply curl upward, creating a 90-degree angle between their finger and the vaginal wall. But research shows the G-spot responds best to stimulation at approximately a 45-degree angle, combining upward pressure with a slight forward pulling motion. Studies using 3D sonography during G-spot stimulation show that the area swells and becomes most responsive when pressure is applied both upward toward the pubic bone and forward toward the vaginal entrance simultaneously. This angle maximizes contact with the erectile tissue and creates the "come here" motion that's most effective. Dr. Adam Ostrazinski's 2012 cadaver dissection study found the G-spot positioned at a 35-degree angle with the lateral border of the urethra, confirming that straight upward pressure misses the optimal stimulation angle. The fix is the 45-degree "come here" technique combined with rhythm. Insert your finger 2 to 3 inches deep to reach the G-spot location. Curl your finger upward toward the pubic bone, but instead of just pressing straight up, add a forward pulling motion, as if you're beckoning someone to "come here." This creates a 45-degree angle between your finger and the vaginal wall. Use a rhythmic motion. Press up and forward. Release slightly. Press up and forward. Release slightly. Aim for a rhythm of about 1 to 2 strokes per second. Not too fast or too slow. Combine this with external clitoral stimulation using your other hand or tongue for maximum effect. Research shows that combined G-spot and clitoral stimulation produces the strongest orgasms for most women. Within 3 to 5 minutes of proper angle stimulation with correct depth and pressure, most women with sensitive G-spots will experience the distinctive G-spot orgasm described as deeper, more full body, and sometimes accompanied by female ejaculation or squirting in about 40% of women. One patient's husband, 68 years old, had been stimulating straight upward for years without understanding the angle component. After I taught him the 45-degree "come here" motion, his wife experienced dramatically more intense responses within the first attempt. He said, "The angle made all the difference. It's not just up, it's up and forward, together." Proper angle is the final piece for mastering G-spot stimulation. Special consideration: the G-spot in women over 60. This is critical information that applies specifically to your age group and relationship stage. Here's what changes after menopause. Research shows that postmenopausal women experience vaginal tissue changes, including thinning of the vaginal wall, decreased natural lubrication, and potential changes in G-spot sensitivity due to reduced estrogen levels. Studies confirm that the vaginal wall becomes thinner and less elastic after menopause, which can make the G-spot either more or less prominent depending on individual anatomy. Some women report increased G-spot sensitivity after menopause because the thinner vaginal wall allows easier access to the underlying erectile tissue. Other women report decreased sensitivity due to reduced blood flow and tissue changes. The fix is adaptation and enhancement for postmenopausal partners. Always use high-quality lubricant generously. Reduced natural lubrication is universal after menopause, and attempting G-spot stimulation without adequate lubrication causes discomfort. Water-based or silicone-based lubricants work well. Allow significantly more time for arousal before attempting G-spot stimulation. Postmenopausal women require 15 to 20 minutes of foreplay minimum for adequate blood flow to the genital area. Be gentler with initial pressure and gradually increase based on her feedback. Thinner vaginal tissue is more delicate and sensitive to discomfort. Consider suggesting she discuss vaginal estrogen therapy with her doctor. Local estrogen application can improve vaginal tissue health, increase natural lubrication, and enhance sensitivity without systemic hormonal effects. Communicate openly about what feels good. Her body has changed, and what worked in her 40s may not work in her 60s and beyond. Within weeks of adapting your technique for postmenopausal anatomy, most couples report renewed pleasure, sometimes discovering that G-spot stimulation is even more effective now than before menopause when tissue was thicker. One patient couple, both in their early 70s, struggled with intimacy after menopause, changed his wife's anatomy. After implementing high-quality lubricant, extended foreplay, and gentler initial pressure, they discovered his wife's G-spot was actually more accessible and sensitive than it had been decades earlier. The husband said, "We thought menopause meant the end of great sex. Instead, we learned new techniques that work even better." Postmenopausal G-spot stimulation requires adaptation, not abandonment. Let me give you the exact step-by-step technique to find and stimulate the G-spot effectively. Step 1. Arousal foundation. Begin with extended foreplay, focusing on kissing, touching, and clitoral stimulation. The G-spot requires high arousal to be maximally sensitive. For women over 60, allow 15 to 20 minutes minimum. Use oral sex, manual clitoral stimulation, or whatever techniques she enjoys most. Watch for signs of high arousal, increased breathing, flushed skin, abundant natural lubrication, or vaginal swelling. Step 2. Proper positioning. Position her on her back with a pillow under her hips to tilt her pelvis upward. This angle makes the anterior vaginal wall more accessible. She can also be in a sitting or semi-reclined position, which some women find more comfortable for G-spot access. Step 3. Lubrication. Apply generous, high-quality lubricant to your fingers. Even if she's naturally well lubricated, additional lubricant ensures comfort during the firm pressure G-spot stimulation requires. Step 4. Location 2 to 3 inches deep. Insert your middle finger slowly, 2 to 3 inches deep, significantly deeper than most men expect. You're aiming for 1/3 to 1/2 the distance toward the cervix. Curve your finger upward toward her pubic bone. Feel for a slightly ridged or textured area on the anterior vaginal wall. During arousal, this area may feel spongy or swollen. Step 5. The 45-degree come here motion. Use firm but comfortable pressure with a come here beckoning motion. Press upward and forward simultaneously, creating a 45-degree angle. Use rhythmic strokes at 1 to 2 per second. Not too fast, not too slow. Start with moderate pressure and adjust based on her response. Step 6. Combined stimulation. While maintaining G-spot stimulation with your finger, use your other hand or mouth to stimulate her clitoris simultaneously. Research shows that combined stimulation produces the strongest orgasms. Many women cannot orgasm from G-spot stimulation alone. Step 7. Communication and adjustment. Ask throughout, "Does this feel good? More pressure or less? Faster or slower?" Her feedback is more valuable than any technique. Adjust based on her verbal and physical responses. Timeline for results. First attempt. May take 5 to 10 minutes to locate the correct spot and establish comfortable rhythm. Don't expect immediate orgasm. Focus on learning her anatomy. After 2 to 3 sessions, once you've identified the location and pressure she prefers, most women begin experiencing intensified pleasure and deeper orgasms. Long-term. With consistent practice and communication, G-spot stimulation becomes a reliable pathway to powerful orgasms for women with sensitive G-spots. Important reality check. Not all women have highly sensitive G-spots. Research shows significant anatomical variation. If your partner doesn't experience intense pleasure from G-spot stimulation, it doesn't mean you're doing it wrong or she's dysfunctional. Some women simply don't have the thicker urethrovaginal tissue that creates strong G-spot sensitivity. Focus on what brings her pleasure, whether that's clitoral stimulation, G-spot stimulation, or other techniques. The goal is her satisfaction, not checking boxes. Gentlemen, here's what you need to understand. The G-spot is a real anatomical area located 2 to 3 inches deep on the anterior vaginal wall, consisting of erectile tissue that responds to firm pressure. But individual anatomical variation means it varies dramatically in size, sensitivity, and even detectability between women. Research confirms that women with thicker urethrovaginal tissue, over 6 millimeters on ultrasound, report stronger vaginal orgasms, while women with thinner tissue, under 3 millimeters, may have minimal G-spot sensitivity, regardless of technique. The 3 critical mistakes that prevent men from finding it are searching too shallow at only 1 inch deep instead of 2 to 3 inches, using wrong pressure, either too gentle tickling or too aggressive jabbing instead of firm rhythmic pressure, and ignoring the 45-degree angle, pressing straight up instead of up and forward in a come-here motion. For women over 60, postmenopausal changes require adaptation, including generous, high-quality lubrication, extended arousal time of 15 to 20 minutes, gentler initial pressure with gradual increase, and open communication about changing anatomy and preferences. Starting today, implement the complete protocol. Begin with extended foreplay, ensuring high arousal. Use proper positioning with hips elevated. Apply generous lubricant. Locate the G-spot at 2 to 3 inches deep on the anterior wall. Use the 45-degree come here motion with firm rhythmic pressure. Combine with clitoral stimulation simultaneously. Communicate throughout and adjust based on her feedback. Remember that not all women have highly sensitive G-spots, and that's completely normal. Focus on what brings your partner pleasure, not on checking anatomical boxes. If this video helped you, hit that like button right now. Comment below and tell me, are you going to try this technique tonight? And subscribe for more science-backed strategies for men over 60. I'm Dr. Mika Hayashi. Understanding female anatomy isn't just about technique. It's about caring enough to learn what truly satisfies your partner. Find the real location, master the technique, transform your intimacy.